Perfect. Okay. Hi, everyone. This is Dr. Sundermeyer with InfusionHealth, and it is Sunday morning, February 21st. And this is our Sunday Buzz. I'm, like I said, Dr. Sundermeyer.
And I'm Dr. Wallace. And just to prove to you that is the Sunday Buzz.
I have my fancy Z cup here. So for our first buzz, we've decided that we're going to go ahead and just answer a couple questions and kind of start moving forward from there. We have some great topics for you today, and we're actually going to single out Dr. Wallace's expertise for the most part today, since I will be slowly venturing onto maternity leave. And so I'm going to start taking a break. So I get to play host.
That's right. A much deserved break. Being pregnant and having our lovely boy. And so we do take name requests because we have 1,000. We have,
it's not like it's like 10. I think that's just going to be his nickname regardless. No.
I'm headed for Aiden. I like Aiden, Hunter, Tristan.
So got some names. That's the understatement right there. We're gonna meet them. We're gonna figure it out. We're gonna go from there.
Yeah, if you have something spectacular, please, you can go ahead and send us some cool names.
Absolutely.
That it is G and PG rated. We don't want PG-13 or rated R.
And if it rhymes with anything, Dr. Wallace will make fun of it right off the bat, just so that he can protect future child from, 9-year-olds.
Yeah, 9-year-olds. Yeah, it's like my last name is Wallace, and so they had mine as Walrus, Kevin Walrus, and I was like, I don't get it, but
I don't think anybody understands what it's like to have a name Zahara. I think I win regardless. And growing up in Arizona, Hispanic Anglo population primarily, and probably the only Zahara in the city. I'm sure there's more, but in my school, every time I was in school, it was something. I think they threw my name into songs like Guala Zahara instead of Guadalajara, and then of course salsa. So I've had and then of course everybody pronounces my name wrong to begin with, so I get it totally.
So the topic, or the two questions that we obviously deal a lot with, female hormones and weight loss.
I think I'm supposed to ask you the questions. You can't take over.
I can't take over?
No. So let's go ahead. We'll start with our first topic, since obviously Dr. Wallace is raring to go. The first question that was actually a private message to me on Instagram at my dr.zahara.nmd site. And obviously don't forget to follow us on Instagram at infusion_health to learn when our next shows and any other things that are going on are. But the first question I have is, how can hormone balance help with weight loss? So obviously, like Dr. Wallace says, a very common reason we meet women today, as well as men, actually. And I think that we want to make sure that we don't rule men out of our conversation. And so we'll definitely have a second part for our next question when it comes to men. But why don't you tell us, Dr. Wallace, what you've seen with hormone balance and weight loss?
Yeah, so we obviously deal with optimization. And so we have a lot of females, younger as well as going through menopause, that are obviously having the inability to lose weight or actually putting on weight. And so that can obviously be relegated to a myriad of things. So obviously that's why we talk about the foundation: nutrition, exercise, sleep. So let's say all of those things are just, you got them dialed in. You're with a lovely trainer, fitness trainer that we love in regards to Modesto. And also there's one in Turlock that if you'd like to know, you can obviously message us and we'll let you know who we actually like to send people to that can help them out with a whole component of exercise and nutrition in that component. So let's say everything is done, you're doing everything right, but you're not losing weight. And so if we think about our body as being a messenger system, well, something has to stimulate another process in order for your body to actually burn fat and utilize fat as a resource. And a lot of those things are obviously hormones. So estrogen, testosterone, these types of things actually tell the body to actually burn fat to help maintain a healthy metabolic weight, as well as help with the mitochondria. So they do it through different receptors. We can get into the whole really complicated biochemistry of the estrogen receptor alpha and actually how it induces lipolysis. those types of things. But the basic general sense is that hormones are the messengers that now tell other processes in the body to actually start to utilize adipose as a fuel source, as well as weight distribution. So that's why as females sometimes maybe get a little bit older, they start to notice like, well, I'm putting more weight upon my thighs, possibly on my midsection, those types of things. And that can be a sign of an estrogen deficiency. And so those are the things that a lot of people come to us, regardless whether you're 22 and you have extremely bad periods in regards to, you know, PCOS, these types of things, and putting on weight. Hormone and the balance of hormones can actually partake in making sure that you stay a healthy metabolic weight. And so obviously testing, seeing your case, testing appropriately, not just estradiol and that's it. We are a combination of a bunch of hormones. So estrogens and progesterone and testosterone and DHEA, all these other things come into play in regards to having a healthy weight. And so myself and Dr. Sundermeyer work exclusively with those basically hormone patterns. It's like, well, if you're deficient and we take a good case, we can sit there and see that, well, you're probably going to go ahead and have some issues in regards to losing weight. And then it doesn't really matter what you do. Sometimes it's like we can starve ourselves. We can exercise until the cows come home, 2 hours a day. I always hear this. It's like I work out an hour a day, 6 days a week. I go ahead and I intermittent fast. I do all of these things, especially the female population, somewhat going into menopause and postmenopause, and I still can't lose weight. It's because we can't go ahead and unfortunately, when the ovaries obviously start to fail or become limited, it's like we can't go ahead and there's not enough urge sometimes to give you estrogen. So we do have to basically supplement those hormones to actually create the benefit that is needed safely.
Right.
So those are the things that we obviously do here in the practice with really good results. And obviously the results from our patients kind of speak for themselves.
Now, before you go forward, but I want to make sure we discuss what you touched on a couple times, but I want to make sure that everybody is understanding the terms too, is that you had said estrogen helps with lipolysis, right? And so just briefly, tell me what lipolysis is. Obviously I know, but tell the world what lipolysis is.
Well, lipolysis is basically burning fat, utilizing fat as a resource to go ahead and burn.
And I think that's a really positive statement right there, because a lot of people are under the impression that estrogen causes weight gain, which I think it's important to know that when in full imbalance and when estrogen dominance is present and progesterone is out of balance with estrogen, so really heavy menstrual cycles, severe bleeding where you're flooding or you can't stop it, right? That is a sign of too much estrogen, which can be inflammatory to the system. But in the big picture, and I think women see it a lot in their mid to late 40s, especially, right? When you said they start packing on the weight, and that's because estrogen becomes so variable during that time frame. I've seen labs where women are really low, and then I've seen labs where they're really high, right? But the biggest common denominator is progesterone is always low, right?
Correct.
So I just wanted to make sure that we touched on that, because I want to start debunking these misconceptions. It's all about that balance, and I'll let you continue forward, Dr. Wallace.
Well, exactly. So it takes sometimes to fine tune it. So like you already know, it's like you can start people on hormones and then you have to basically see what happens. And so sometimes females will go, well, it feels like I'm putting on more weight, those types of things. Well, it does take a little bit of a regulatory kind of stance in regards to, well, your body has to know it again. You have to have a balance between those two hormones. And like Dr. Sundermeyer said, your estrogen can be low and your progesterone can be really low, but you'll still have an estrogen dominance, because the estrogen, even though it's really low, is lower than progesterone or higher than progesterone. Progesterone's in the tank. Right. So the concept is finding the balance between all of those, and obviously going through the whole process of making sure that you're still eating well, doing stuff to detoxify from some of the metabolites, making sure the liver is functioning well. So all those come into play and how estrogen affects the body. And that's why we like to go ahead and see our patients, on a frequent basis, just because we have the ability now to have more control. When I say more control, we can switch things on up rather than like, well, here's estrogen, I'll see you in 8 months. I mean, things can go wrong in 3 weeks. And if I don't really see you again in 8 months, it's like, you're going to hate me and you're going to sit there and give us a bad Yelp review. So we want to make sure that we're on Johnny on the spot in regards to, well, is this fine tuned? Is this in the proper ratio?
Mm-hmm.
Are you having excessive stress that we need to add in different maybe herbals to help on out with your progesterone, because progesterone gets stolen to cortisol and those types of things. So it's like Dr. Sundermeyer said, it's like, it's all a balance. It's not just, well, here you go, you come in, you're menopausal, I'm just going to ramp you up with estrogen and I'll see you later. I mean, that's fixing for you to go ahead and not feel well in that regards. And we, like I said, are just very poor doctors because we're not looking at the whole totality of everything.
Right. Well, and I think that's definitely a good starting place. Now, obviously, every case is going to be a little bit different, and I think that's super important to realize. And that's where the blood work comes into play, or that's where the urine testing comes into play. And so it's not just a quick consult and a case study or a history intake and a cool, you're losing or you're gaining weight or you can't lose weight. You're in that plateau, right?
Mm-hmm.
It's that time that takes between understanding what actually needs to be done, and then of course then getting it done. So I think that that's super important, and I definitely think women today are noticing estrogen imbalance issues even now into their 30s. Oh, yeah. And so just because you're in your 30s and your menstrual cycles are starting to shift, I think it's important to know that it's not just there's something wrong with you, right?
Yeah.
So with that being said, I mean, I think the contrast goes for men. I mean, because what we haven't really talked about is testosterone in men's weight. And you, of all people, know about testosterone's impact in men's weight and how you noticed that change. So tell us a little bit about what you've seen with your men when it comes to weight balance, even if it's low T as opposed to deficient T.
Yeah. Well, real quick, before we're going to go, there's a lovely link that we have for anybody that wants to read all the study in regards to estrogen, obesity, and menopausal females. And so when I say obesity, don't look at that as a negative thing. The concept is obesity just means I'm not able to lose weight or have an optimal weight. And so it's not going to sit there and say, estrogen and you can't lose weight because you're in menopause. They're going to do studies in regards to obesity. And that's, like I said, what we deal with in regards to females that can't lose weight. It's the same messenger. It's the same way the body actually utilizes estrogen to influence different receptors and mitochondria, as well as the brain in regards to satiety. So you actually know that when you're full, and different gut hormones like cholecystokinin and GLP-1. So everything is influenced in regards to that tell our brain to cut it off. Everybody's probably heard of leptin and ghrelin. Well, those things are influenced by hormones. And so if your hormones are in the tank, well, you might have more ghrelin. Okay, that's causing you to sit there and feel like feels like I'm still hungry. And we can't put nutrition into the cell to actually have the cell sit there and say, hey, I got it, we're good. Send out the other receptors and stuff like that to let us know that we don't have to go ahead and have as much food. So all those things are influenced by estrogen, and there's a great study that talks about it. So you don't just have to hear from me, you can hear from other people that have a lot of acronyms after their names that we obviously study and research. We'll now transition over to men. So testosterone, great for men and women. And so the one thing that I think that most people don't understand, testosterone is our motivator too. It's like it helps us get motivated to do basically events and finish tasks and work out, and gives us the drive to want to go and do those things. So they did fantastic studies in regards to people having low testosterone and high testosterone, and they put them in front of a task, and the people that had low testosterone, after a while, it was like squirrel, and they didn't finish the task. And so when you have a higher testosterone, the people were able to finish the task. So the whole concept is, I used to be able to go to the gym, I got my good pump. You know, the guy's always like, I got my good pump, you know, those types of things. I said like an Arnold Schwarzenegger kind of
Oh,
concept,
Jesus.
you know, you choppa. And so those types of things actually help us want to go back to the gym and want us to go ahead and be entrepreneurs and want us to go ahead and feel like we feel that muscle burn, those types of things. But testosterone has the same effect in regards to estrogen. It helps in regards to lipolysis and lean muscle mass. And the more muscle mass that we have, the more of a burner our bodies are, the more that we're insulin in regards to our insulin is more under control. You know, obviously these things are all important. You can't, you know, have a 32 ounce of Pepsi and take testosterone and go, you know, Dr. Wallace said this was great. It's like, no, dude, you know, it's like you gotta feed the system as well. But the concept of having too low of testosterone will actually create that that same composition of men. Higher lower basal metabolic rate, higher incidence for insulin resistance, more, like I said, basically heart issues, libido, which every guy probably knows for testosterone, but also, like I said, the motivation, the drive, the want to go ahead and do things, and the vitality. And that's the same thing for females. And so those are the things that we go ahead and do, obviously, with our guys. And that's why a lot of studies show also that guys don't have as many autoimmune disorders in their, obviously, as they age. So a large proportion, whatever, like, you know, rheumatoid arthritis, and lupus, and these types of things that females have, just because as they go or they grow older, testosterone decreases and they have a higher incidence of autoimmunity. So it kind of leads you to believe that also testosterone has an influence on our immune system. And so those are the things that are important as well, because our immune system is just not for us to fight off a cold or a virus or anything like that. It's also for repair. So our immune system actually repairs the system. So when we have too low of testosterone, our body is broken down and it can't repair as fast as it should. So then it's basically backed up, and we're always in, like I said, in that kind of a vicious cycle. And that's why you see a lot of men that have low testosterone feel like, you know, they injure easier, they can't go ahead and recover as fast, which obviously can be cortisol issues as well. And so those are the things that testosterone does to go ahead and help out men.
Right. Well, and like you said, the lower the T, the more inclined a man is to have higher adipose tissue or fat cells. So more pectoral fat, more abdominal fat, more love handles, right? And again, that lack of drive, which is super important if we want anyone to exercise or if it's a part of the therapy, right? Not everybody gets to exercise as a part of their therapies, depending on their adrenal glands and how fatigued their systems might be. But in the realm of testosterone in men, it's, I always say it's your primary hormone. It's the hormone that's going to drive you, support cognitive wellness, mental wellness, and of course, support, lack of depression, which I think is super important. And obviously estrogen does the same thing with women. But women also need testosterone, which is, I think, a really beautiful way to segue into the benefit of testosterone in women. Obviously, we talked a lot about the benefit of testosterone in men, but would you say that it's pretty similar in correlation?
Yeah.
Obviously, women don't need as much. I think we're, 0.5 to 5 grams or milligrams per day, versus men are, 50 to 200 milligrams per day. So there's a huge dosing strategy difference. And I think it's really important that women understand that you're not going to grow facial hair the second you get testosterone.
Correct.
But if it's dosed inappropriately, that's obviously the thing. You can always build up, but you can't just take away when you've added too much, right? It's like the salt theory. Too much salt.
So the concept too. So again, another great study that we'll put the links on up so you guys can read in regards to testosterone and obesity. That the great study that they didn't do anything. They just give men testosterone. Men that were low, obese, no exercise, no nothing. Obviously we don't want you to do that. They gave them testosterone appropriately. I do believe the study was over, I think, a 3-month period. It's like all of their other parameters improved. Cholesterol level or lipid levels, triglyceride levels, insulin levels, all of those things improved.
Okay.
So the concept is, again, that messenger. So you have low testosterone. Well, what priority does now testosterone have to take in order for you just to function? So who cares about your cholesterol? Who cares about your sex drive? What technically does testosterone have to control in order for you to get up in the morning and breathe and stuff like that? So our body does have a hierarchy of like, well, who cares if a female can have great sex or have proper brain function or brain fog, as long as your brain and your heart and your lungs are operating, I guess you're alive. And so, what kind of things are, when you're deficient, that the body slows down other mechanisms in order to keep the ones that are really important so you can actually get up in the morning and pay your bills. And so that's the concept of why we like to do life enhancement medicine, because there are levels. When you go see a lovely physician from a company that rhymes with miser, in regards to, they look at you and they go, yeah, you're fine. Yeah, you're good. And then there's our levels where it's like, no, it's like you represent with an androgen deficiency. So it doesn't matter whether your testosterone for a female is 45, it's like you're experiencing those types of deficiencies. Well, maybe you need more. And the same thing with a man, if you're at 350 and it's like you're within range, but you're experiencing androgen deficiency syndrome, it's like, no, you need testosterone. Okay. And so the thing with females, it's the same concept. So drive, libido, muscle mass.
Mm-hmm.
The women have a harder time as they age to go ahead and keep their muscle mass. And so testosterone will help with that. And then obviously a healthy muscle doesn't just go ahead and produce, movement. It actually produces different hormones that can balance insulin and mood and those types of things, as well as having those different other chemicals like cholecystokinin and GLP pop out a little bit easier and get past the blood-brain barrier to let the brain know, okay, you're satiated, you've had enough food, those types of things. And so testosterone helps on out with that. Obviously, the mitochondria is very important in regards to testosterone and helping it become, like I said, more of a fat burner, lipolysis. So these things are important for females. Obviously, we don't want our females to look like men. Some females do in regards to that, but obviously the females that we go ahead and work with, we want to make sure that they're able to go ahead and maintain muscle mass, maintain their sexuality, those types of things, make sure they have vitality and vigor. And that's why we always have men and women, if they can, come in the same time. So if the female's going through menopause and they start to feel better and their sex drive starts to improve, but yet the man still is kind of like in the doldrums, it's like we always request that they come in and see each other, or myself, Dr. Sundermeyer, so both of you can be elevated, because it's really tough to have somebody now become very vital, whereas a partner is not, and that kind of conflict in the relationships, and we obviously don't want that. And so we want to make sure that men and females come on in to go ahead and be seen, so they can go ahead and improve the whole situation.
Well, and there was a point that you made while speaking that, it all depends on the female's symptoms. So just because your lab values look healthy or even midline doesn't always mean that your system is healthy. So we have to take someone like Serena Williams, for instance, who is a very testosterone driven female. She's athletically built. She's got a very high muscle mass. She obviously has a very high stamina environment and requires a high stamina environment. And so as she ages, for instance, her testosterone level naturally might be in the 80s just because of the amount of muscle she has. And we're talking total testosterone. We haven't even touched on, total versus free. And obviously each person's a little bit different with that. But now say she's not as athletic because she's decided she's finally going to retire. And her testosterone levels start to decline, still in the normal range, 30, say. It's a very healthy testosterone for someone like myself that's no longer athletic like I was when I was, 15 and played sports every day after school, as opposed to sitting in a desk all day. But for her testosterone was happiest and most beneficial for her system in that 80 mark, we'll say. And so it's really important to understand that just because you're a female and just because your labs indicate a normal value doesn't mean that your body isn't more upregulated or healthier when your levels are a little bit higher, just based on your personal background. So if you were a professional athlete or always athletic somehow, and then you've stopped because of an injury, well, that's going to affect your sense of well-being, and not just physically, but also emotionally, because of what testosterone does for sense of wellness, depression in women, as well as depression in men, like we said, but obviously also sense of self-worth also changes with testosterone. And so it's definitely important to know that it's understanding the person who's in front of us as well. It's not just reading a lab. And I think that's a very key thing that a lot of practitioners have forgotten, is don't treat lab, is what one of my mentors used to say. Don't treat labs, right? It's a 50-50 conversation in what your patient is telling you. Now, of course, a lot of it relies on blood work or urine testing, but a lot of it relies on creating and understanding that balance, right? So,
well, the cool thing is, I'm taking some of the certifications to the A4M, just in that. So the people that basically went ahead and created the A4M, they wrote a big paper about in regards to androgen, in regards to utilizing anabolic steroids and sports. So they basically said that was totally for sports. It should mean nothing in regards to life enhancement.
right.
So the concept is, but the physicians nowadays and the governing board sit there and say that, you're not supposed to do this for a person that's, 55, and growth hormone is like a big example, which we'll talk about. So when they were actually the ones that wrote the position papers on those. And so they were like, no, it's like people that have a growth hormone deficiency, you shouldn't have to go and just treat people that have dwarfism or cachexia. This is because of everything. So the whole concept about even utilizing testosterone, that's like, oh my God, testosterone, you're going to abuse it. Obviously there are people that are, but those are the people that are usually not underneath doctor's supervision.
Right.
The people that are underneath doctor's supervision, doesn't matter how old you are, if you're testosterone deficient because of either an injury, a virus in the earlier days, that you're very toxic, those types of things, it could start from 18 until, you're 90. So the whole goal is life enhancement, is to make sure that we have a healthy life throughout. And one of the good stories that I have is like one of my patients, early 30s, dealing with depression his whole life on all kinds of meds, and no one tested his testosterone. His testosterone was 9.
Well, and with that being said, what is the normal range for a testosterone lab, we'll say?
Yeah, usually 250 to 1200.
Right. And for a 30-year-old, average testosterone ranging 600 to 800, maybe?
Yeah.
Depending on activity level. And if he was 9, I mean, that's definitely more of a female value, right?
And so gave him testosterone. All of a sudden, miraculously, his life just opened on up. When I say more confident, is like he was afraid to go out and do stuff. Whether, obviously I knew his history, issues, younger days in regards to family stuff or family structures, those types of things, that kind of like just browbeat, those types of things. But he's now, like I said, fantastic, able to go ahead and live life, those types of things. And so no other physician went ahead and looked at his testosterone, okay? Because they're like, well, you're 30, so you should be okay.
Right.
In that regard, it's like, no, man, 9. And it's like, we had to do it again, because I was like, 9, that's an error.
Right.
I ran it again, it was like 11.
Well, and I think that's an important thing that we talked about. So just as women are starting to lose estrogen and have more estrogen and hormone imbalances now in their 30s, we're also starting to see men with testosterone deficiencies or low testosterone levels. Now, is it a stress, presence? Is it associated with environment that's affecting testicular health? I mean, these are the big questions of each individual case, but in the big picture, if we're seeing someone in their 30s with an extremely deficient testosterone, obviously, support is necessary. And I'd say that's where you're looking outside the box, out of conventional everyday primary care medicine, right?
So, the bad thing is, which we try to tell our patients, the kid is born, plastic bottle, plastic pacifier, perfume diapers.
Well, and that's extremely important with young women, especially.
All those things are xenoestrogens. And so we have to keep our males and females
Mm-hmm.
away from those things, because it's like they're already basically at a deficit. Studies have shown now since, I think the 1920s, that sperm counts, testosterone levels are just obviously just going down like the stock
Right.
market in regards to 1929.
Right. So, and with that statement, so just as an example, because I do some preconception and fertility care, men's testosterone, or sorry, semen analysis used to normal per 1 ml would be over 100 million per milliliter sperm in that one sample. And now it's somewhere along the lines of like 40 million per milliliter. So that's a 50% drop in over 50 years, or in the last 50 years, I should say. I think the research is from the 1950s. And so, I mean, it's definitely an indication that something has changed in our environment for each individual's health. Absolutely.
So there's all kinds of cool things. HCG, everybody probably heard the HCG diet that helps on out, with the man in regards to helping his LH and FSH pathway. There's a fantastic peptide now called gonadorelin that helps on out with LH and FSH pathway. Clomid, same concept. And then there's some other peptides like kisspeptin. So the concept is, let's say you're 22, your testosterone is low, and then we necessarily don't want to give you testosterone. The things we can do to, when I say add to the system, in order for your body to make testosterone. And so those are the fantastic things today. So obviously we talked about some of the things about testosterone, estrogen in females. Again, we can go into all kinds of depth and charts and receptors and mitochondria, but this is kind of like just the Sunday buzz for the general. It's like, if you guys really want to have me nerd out, I can go ahead and do a PowerPoint.
Yeah, please don't let him make another PowerPoint. We're good with those.
Sunday buzz, just like this.
Here we Sunday buzz nodding off for sure. No PowerPoints from Dr. Wallace.
It's like med school. I'm trying to think what class do I always nod off in med school. There's like a couple of classes where I'm like, can I just read this stuff, man? But anyways, we enjoyed having you for our first Sunday buzz. Dr. Sundermeyer, I think, will tell you about what is the next one going to be about.
Thank you. Well, first, obviously, thanks for joining us and thanks for listening in for our first Sunday buzz. Our next one will be on March 21st, 10 a.m. We will offer the Zoom link on our Instagram page. The link is infusion_health on Instagram. And so you'll find it on our main page in that link section. I'll place it there today. But Arizona and California will officially be on the same time zone at that point. So it will be 10 a.m. across the board. Since we, I think, start daylight savings on March 14th, I think is what it is. An Arizona person never understands daylight savings time. They just live within it when they have to. But at this point in time, thank you so much for joining us today. And we hope you enjoyed the information that you learned. If you have questions or would like to schedule an appointment, definitely look at the link above Dr. Wallace's shoulder, integrativetelemedicine.com, and you can reach out to us there. And again, follow us on Instagram, infusion_health. We hope you guys have a very beautiful Sunday, and we will see you guys at our next Sunday buzz.
Yep. Spread the word. Get the link. Get to all your buddies. All that stuff. Growth hormone is going to be fantastic today.
Oh, yes. Did I say that? We're talking about growth hormone and its many faceted uses.
Correct. Everything to do with growth hormone, the peptides, how to go ahead and maximize it in regards to dietary, other supplements, those types of things, and the importance of growth hormone. But if you guys, like I said, all the females and males, I always put up here, but we have a great post out. If you want it, we can help you get it. So if you want to go ahead and lose that weight, gain lean muscle mass, be vibrant, check us on out. Everything's easy. Telemedicine. So you can see us at the comfort of your home, have slippers on, like I know Dr. Sundermeyer probably has on it, even though.
Totally. The joys of the shoulder up view.
Correct. I was out grouting my pizza oven. So anyways, everybody,
have a great day. Enjoy your Sunday.
Bye.
Bye-bye.